One of the most confusing types of pain people deal with is pain in the lower back that they can't figure out because sometimes it isn't actually coming from the back at all. It's coming from the kidneys. And the tricky part is that kidney pain and back pain feel almost identical, sit in the same area of your body, and can even happen at the same time. In this video, I'm going to show you exactly how to tell the difference between kidney pain and back pain, what's causing each one, and the exact steps you can take to get rid of both. Let's get into it. How to tell kidney pain from back pain. Before we talk about causes and solutions, you need to know how to tell these two apart, because the treatment is very different depending on which one you have. Where the pain sits. Kidney pain typically sits higher in the back than most people expect. Your kidneys are located just below your rib cage on both sides of your spine, roughly at the level of your mid to lower back. The pain is usually felt in the flank area, which is the space between the bottom of your ribs and the top of your hip on either side. Back pain from muscles or spinal structures tends to sit lower in the lumbar region and often spreads across the full width of the lower back. How it feels. Kidney pain tends to feel like a deep, constant ache that doesn't change much when you move, stretch, or change position. It can also come in intense waves, especially with kidney stones. Muscular or spinal back pain, on the other hand, almost always shifts. When you move, it gets better or worse, depending on how you're sitting, standing, or bending. The tap test. Here is a quick self-test. Make a loose fist and gently tap the area just below your rib cage on each side of your spine. If this creates a deep, nauseating ache, that strongly suggests the pain is kidney-related. If tapping doesn't change the pain significantly, the source is more likely muscular or spinal. Associated symptoms. Kidney pain almost always comes with at least one other symptom: pain or burning when urinating, cloudy or dark urine, increased need to urinate, nausea, fever or swelling. Pure back pain from muscles or discs rarely causes these symptoms. If you have back pain plus any of those signs, your kidneys need attention. Common causes of kidney pain and back pain together. Now let's go through the most common reasons these two types of pain show up, either separately or at the same time. Number 1. Kidney stones. Kidney stones are one of the most painful conditions a person can experience. They form when minerals in your urine crystallize and clump together inside the kidney. Small stones may pass without much pain, but larger ones cause an intense cramping pain in the flank that comes in waves and can radiate down into the lower abdomen and groin. The back aches constantly between waves. This pain is often accompanied by blood in the urine, nausea, and a strong urge to urinate frequently. Number 2. Kidney infection. A kidney infection, medically called pyelonephritis, usually starts as a urinary tract infection that travels upward into the kidneys. It causes a deep, persistent aching in one or both flanks, often with fever, chills and pain, or burning during urination. The back pain from a kidney infection tends to be constant and does not respond to stretching or movement the way muscular pain does. This is a condition that always requires medical treatment. It will not resolve on its own. Number 3. Kidney disease and reduced kidney function. Chronic kidney disease often progresses silently for years, but as function declines, many people develop a dull, persistent ache in the flank and lower back. This is sometimes accompanied by swelling in the legs and ankles, fatigue, and changes in urination. Because the ache mimics ordinary back pain so closely, it's frequently missed or misattributed to a spinal problem. Number 4. Dehydration. This is the most overlooked cause of combined kidney and back pain. When you are chronically dehydrated, your kidneys are forced to work harder to filter concentrated waste. This creates a persistent low-grade ache in the flank and lower back. At the same time, your spinal discs, which are mostly water, begin to lose their cushioning and height, increasing pressure on the lumbar spine. Dehydration is simultaneously stressing your kidneys and your back, and most people drinking coffee and soda all day have no idea this is happening. Number 5. Musculoskeletal back pain, mistaken for kidney pain. On the flip side, many people assume they have a kidney problem when the pain is actually coming entirely from the muscles, joints, or discs of the lower back. The quadratus lumborum, a deep muscle that runs along each side of the lower spine, when tight or in spasm, creates a deep flank ache that feels almost identical to kidney pain. Poor posture, prolonged sitting, heavy lifting, and muscle imbalances are the most common triggers for this type of pain. Number 6. Referred pain between the two systems. Because the kidneys and the lower back share overlapping nerve pathways, pain from one can genuinely be felt in the other. A kidney issue can make the surrounding back muscles tighten and ache. A spinal issue can create sensations that seem to come from the kidney area. In some people, both problems exist simultaneously and feed into each other. That a kidney irritation tightens the back muscles, and the tight back muscles restrict blood flow to the kidneys, making both worse. Lifestyle habits driving both problems. There are specific daily habits that are silently making both your kidneys and your back worse. At the same time, not drinking enough water. If you are not drinking at least 2 to 3 liters of water per day, your kidneys are under constant stress and your spinal discs are slowly dehydrating. Most adults in the modern world are chronically underhydrated and have no idea it's a primary driver of their back and kidney pain. High sodium diet. Eating too much salt forces your kidneys to work overtime, filtering excess sodium from your blood. Over time, this strains the kidneys, raises blood pressure, and can contribute to stone formation. The same high-sodium diet also promotes inflammation in the spinal joints and surrounding tissues, making back pain worse. Processed foods, fast food, and packaged snacks are the main culprits. Prolonged sitting with poor posture. Sitting for hours with a rounded lower back compresses the lumbar discs and strains the deep muscles of the flank. Over time, this creates both structural back problems and reduced circulation to the kidneys. Standing up and moving every hour is not optional. It is a direct treatment for both conditions. Overuse of painkillers. This is critical. Non-steroidal anti-inflammatory drugs like ibuprofen and naproxen are among the most common medications people take for back pain. But long-term or heavy use of these medications directly damages the kidneys. If you are taking these drugs daily for back pain, you may be solving one problem while quietly creating a much more serious one. Exact solutions: how to get rid of kidney pain and back pain. Here are the specific steps to address both problems. Some target the kidneys directly, some target the back, and some fix both at the same time. Fix 1. Hydrate aggressively and correctly. Start drinking a minimum of 2.5 to 3 liters of water per day, every single day. Not juice, not coffee, not soda, plain water. This is the single most powerful thing you can do for your kidneys. It flushes out minerals before they crystallize into stones, reduces the concentration of waste products the kidneys must filter, and rehydrates your spinal discs to restore their cushioning and height. Add a squeeze of fresh lemon to your water daily. Lemon juice contains citrate, which actively prevents kidney stone formation. This is one of the most well-supported natural interventions for kidney stones that exist. Fix 2. The Kidney Flush Diet Protocol. For 2 weeks, eliminate the foods that most directly stress your kidneys and inflame your back. These are processed sodium, alcohol, red meat in large quantities, and sugary drinks. Replace them with kidney-supportive foods: watermelon, cucumber, celery, leafy greens, berries, and foods rich in magnesium like pumpkin seeds and almonds. Magnesium is particularly important. It binds to oxalate in the gut before it can reach the kidneys and form stones, and it also relaxes the smooth muscles of the urinary tract, reducing cramping and pain. Most people with recurring kidney stones are deficient in magnesium. Fix 3. The Quadratus lumborum stretch. This directly targets the deep flank muscle that mimics kidney pain when tight. Stand with your feet shoulder width apart. Raise your right arm overhead and lean your entire torso to the left, creating a long stretch along the right side of your lower back and flank. Hold for 30 seconds. Switch sides. Do 3 sets per side twice a day. When the quadratus lumborum releases, the deep aching in the flank area drops significantly. And many people discover this was a major part of what they thought was kidney pain. Fix 4. Lower back decompression. Lie flat on your back on the floor. Pull both knees to your chest and hold for 30 seconds. This decompresses the lumbar spine, takes pressure off the spinal discs, and allows the deep flank. Muscles to relax. Do this for 3 sets every morning before getting out of bed and every evening. Before sleep. If you have both kidney irritation and lumbar tightness, this stretch addresses the spinal component and provides noticeable relief within just a few days of consistent practice. Fix 5. Heat therapy on the flank. Apply a heating pad to the flank area, the sides of your lower back just below the rib cage, for 15 to 20 minutes. Heat relaxes the surrounding muscles, improves local blood flow to the kidneys, and reduces the cramping sensation associated with kidney irritation and muscular tightness. This works for both kidney-related and musculoskeletal flank pain. Epsom salt baths are even more effective. The warm water relaxes the entire back musculature while the magnesium absorbs through the skin, reducing inflammation in both the muscles and the kidney area. Aim for 3 to 4 baths per week when pain is active. Fix 6. Core and back. Strengthening to protect the spine. Once the acute pain settles, building strength in the deep core muscles protects the lumbar spine and reduces the load on the structures surrounding the kidneys. The 2 best exercises for this are the bird dog. From all fours, extend your right arm forward and your left leg back. Simultaneously, hold for 3 seconds, return and switch sides. Do 10 reps per side. This builds deep spinal stability without compressing the lumbar joints. The side plank. Lie on your side and push up onto your forearm and the side of your foot, keeping your body in a straight line. Hold for 20 to 30 seconds per side. This directly strengthens the quadratus lumborum, the muscle most responsible for flank pain, which means a stronger version of that muscle causes far less pain over time. Do this routine 3 to 4 times per week. Within 3 to 4 weeks, most people report a dramatic reduction in flank and lower back pain. Fix 7. Movement breaks. Throughout the day, every 45 to 60 minutes of sitting, stand up and walk for at least 2 to 3 minutes. This keeps the lumbar discs hydrated, prevents the quadratus lumborum from seizing up, and maintains circulation to the kidneys. Set a timer if you have to. This simple habit alone has been shown to significantly reduce both lower back pain and kidney stress over time. When you must see a doctor immediately. Some causes of kidney and back pain are medical emergencies that cannot be treated at home. Go to a doctor or emergency room immediately if you experience any of the following: severe, sudden flank pain that comes in intense waves and does not ease with rest, or position change. This is a classic kidney stone attack. Fever above 38 degrees Celsius or 101 degrees Fahrenheit, alongside back or flank pain. This indicates a possible kidney infection that needs antibiotics urgently. Blood in your urine, whether bright red or cola-colored. This always needs investigation. Inability to urinate or significantly reduced urine output alongside back pain. This can indicate a blockage or acute kidney failure. Severe pain in someone with a known history of kidney disease, diabetes, or high blood pressure. The solutions in this video are for chronic, recurring kidney and back discomfort driven by dehydration, diet, muscle tension, and lifestyle. Acute kidney conditions always require medical attention first. Your simple 30-day daily routine. Follow this routine consistently for 30 days and you will notice a clear improvement in both your kidney discomfort and your back pain. Every morning, drink a large glass of water with fresh lemon juice before anything else. Then, do 3 sets of the knee to chest decompression stretch on the floor before you get up. Throughout the day, drink water consistently, at least 8 to 10 glasses. Set a reminder every hour to stand up, walk for 2 minutes, and do a quick quadratus lumborum side stretch. 3 to 4 times per week, do the bird dog and side plank strengthening routine. It takes 10 to 15 minutes and directly targets the structures causing both your back and flank pain. Every evening, apply a heating pad to your lower back and flank for 15 to 20 minutes. If possible, follow with an Epsom salt bath 3 times per week. Every day, reduce processed sodium, avoid daily use of ibuprofen or naproxen, and replace inflammatory foods with kidney-supportive ones: watermelon, cucumber, berries, leafy, greens, and magnesium-rich foods. After 30 days of this, most people report that both their kidney discomfort and their back pain have reduced significantly because they are finally addressing the root causes instead of just masking the symptoms. That's everything you need to know. How to tell kidney pain from back pain, what's causing both, and the exact steps to fix them. If this video gave you clarity, hit the like button and subscribe for more practical back pain content every week. Leave a comment below telling me whether your pain feels more like a deep flank ache or a lower back ache. I'll reply and point you toward the most relevant solution for your situation. I'll see you in the next one.